to Talking Dogs with Sally Gutteridge. I am really pleased to introduce Kylie Marks to you today. Kylie is a dog physio, human physio, and is just starting a movement to support dogs with arthritis in Australia. And Kylie also has a school community where you can go for help with your senior dog or dog with arthritis. So I'm really, really pleased to have you here, Kylie. I'm really, really pleased
Thank you for
to
having
be
me. I'm so
sharing your
excited.
message.
So excited.
So do you want to tell us about yourself and why canine arthritis is so important to you?
I love canine arthritis, and I think it is just sadly very misunderstood all over the world, not only in Australia, but I feel more so in Australia. And also, we have a different type of attitude towards things, like she'll be right. And you just kind of think, oh, yeah, that's just old age. And trying to educate people to think that, yeah, it's canine arthritis can be managed, and when managed well can be the difference between an early euthanasia to a later euthanasia. It can be the difference between being able to keep walking or having them in a wheelchair or a, you know or in a pram. So like it can make a significant difference, and it really doesn't take much. It just takes a little bit of knowledge, and you can change their world. So that's why I love canine arthritis. I've been a human physio for almost 20 years. Particularly, most of that time has been in aged care. So arthritis and, falls prevention is like my bread and my butter for work. And it's just sad that, even though anatomically we're so different, you can definitely translate a lot of the problems in humans to dogs, and we need to give dogs that attention that like we give humans.
Ah, that's beautiful. That's really great from the heart for you.
Yeah.
And I think you will make such a difference for dogs because it's clearly the centre of your world. Do you see dogs on a daily basis and think, oh, I need help? Out and about when you're walking your dog, do you recognise problems that make you want to get on with your message?
Oh, it's so hard, isn't it? Like I see dogs, there'll be a day when I might see five, six dogs walking while I'm driving around because I'm a mobile physio, so I will go to people's homes. And I'm like, that dog is limping. That dog's almost lame, or that dog's bunny hopping, or that dog's really keeping their head low and slow walk, and he's being pulled, or you see a lot, don't you? And obviously I'm in a vehicle, and I wish I could stop and say something, but even then, I remember posting something in Facebook, and I mentioned something, and the majority of people said, mind your own business. So it
Mm.
makes you really think, like I want everything I say is out of care for the dog and respect. And I'm not here to shame any pet parent, because we are all just doing the best we can. But it is really hard. Like you can't really comment on those things, but it just breaks your heart when you're like, I really hope and pray that that dog is getting the care that they need.
Yeah, yeah, I get
Yeah,
that completely because I see it with behaviour.
yeah,
And you can see discomfort and you just so desperately want to help the dog, but
yeah,
people are defensive and so
yeah.
it's hard to make a difference. So, do you want to
And can
tell?
I also add,
Yeah,
Sally,
please,
like
please.
I think what's difficult for our type of profession, with exercise therapy, which so arthritis is my passion and my love, but part of that is educating the importance of using exercise therapy as a treatment, because I think a lot of people will, just they'll do as many supplements as they can possibly afford, and I'm like, well, some of those aren't scientifically proven to even help. And yet exercise therapy is proven to help your dog. And exercise therapy and behavior management, these, you're in for the long game. Like, there's no quick fixes with our professions, and I think that makes it even harder to encourage people to like just keep going. Like, people just want to resort to the path of least resistance, and I think it's really hard for us because we have to essentially sell behavior management and sell exercise therapy, which can obviously be so beneficial for the dog, but we have to sell it to people who don't want to do the work or don't feel that there's a need for it. So that's where the education comes in.
Yeah. Can you explain exercise therapy in more detail?
Yeah, absolutely. Sorry, I get excited.
I love
it. So with exercise therapy, essentially when a dog, so most dogs that have arthritis are senior dogs. But of course, it does still happen in like 20-30% of dogs that, of a younger age. But when you've got a senior and arthritic dog like I have, we're fighting two lots of muscle losses. We're fighting the muscle loss from sarcopenia, which is age related, which just happens as you get older, happens in both people and dogs. And then we're also fighting the muscle loss that happens with arthritis, because arthritis kind of switches off the surrounding muscles and makes them smaller and weaker. So that's why our senior and arthritic or arthritic dogs, struggle getting up, because it takes a lot of muscle power to get up and they just don't have it. They struggle going upstairs, or they struggle going for their walks, or they start limping towards the end, or they stop jumping onto the couch. And that's because those movements require a lot of strength, and because of those muscle losses, they don't have that strength. And so exercise therapy, not only, my passion is strengthening, so like exercise therapy is like that umbrella, and underneath there's strengthening, which is what we need. But also there's other types of like exercises. So, things like range of motion exercises, which help stiffness, and then things like stretching, which helps tightness. And then you've got the exercise therapy, the strengthening, that helps the weakness. So each form of exercise has its particular function, and it depends on how the dog presents. But the goal is to emphasize the importance of that a lot of our dogs' problems with arthritis and age is weakness, and we can help that with strengthening.
Yeah, that is so fascinating. And I suppose it's really important as well that we get qualified help. We don't just try to create range of movement, and we don't just try to create strengthening. We actually get someone who has studied. Otherwise, can we make things worse?
Yes and no. So generally, I think the problem that I see the most is when people are trying to do strengthening by themselves. They're doing it wrong in the form of repetitiveness. And because in order for a muscle to grow, it needs to be challenged. So if I'm lifting a pencil 100 times, my muscle will get tired, but it's not going to grow because it hasn't been challenged. If I lift 10 kilos, then that's enough stimulation for my muscle to grow. So people will often do cavaletti poles. So that's, when they put the pole is connected to the cones and they just walk over it. And they'll do that, which is great. But if you keep doing the same exercises, the muscles get used to it and they won't grow. And so you're kind of wasting your time because you're not progressing it. And so you're not seeing those improvements. So the dog will not actually, improve. It is... it's unlikely. Like, a lot of my strengthening exercises are so gentle. And, like in my programs and my app, like I have a video and I have directions so that people can see exactly what to do. It's unlikely that you will injure your dog doing something, but I have found when people try and stretch their dog, they, because they don't know the alignment of the joints, they pull the leg, say, in
Mm,
with rotation, or
mm,
and it's like, oh, you're not supporting the leg there, or you're twisting it, and that's kind of the only issue. But even then, like, if you go slowly and gently, your dog will tell you if something's
mm,
uncomfortable, and if you're like, oh, that really hurts them, I wonder why, and check in, with a physio and say, hey, they don't like that. It's like, okay, well, let's check that you're doing it right, and go from there.
we had a physio with my dogs, and we did the cavaletti poles, and we did a lot of sit stands and things, and
Yep.
we also did the the wobble cushions and things. What do you think about them?
Oh, I love them. I think that, my programs might have 20 different strengthening exercises in them, and I progress them. So like one exercise might have 3 or 4 progressions. And so, yeah, I think those exercises are fantastic, but if they're too easy, that's when you're going
Mm,
to kind of hit the wall of we can't go any further. So, for sit to stands, for example, that you need to make sure that the dog does properly, because sometimes they might sit on their side and they're not actually getting up properly.
mm,
You can make that harder by making them do it on like a mattress. That makes it harder because it's wobbly. Then to make it harder again, you can do it like up a hill. So things like
yeah,
that, you can there's ways to progress those exercises. But I mean, variety, I think, is really important. A
yeah,
little bit of everything, as long as it is over time, it gets just a little bit harder to challenge those muscles.
yeah. I think I would probably say that keeping your program is a good choice, as opposed to kind of going online and seeing what people do and trying to assess your dog without your dog having been looked at or assessed, because it's not definite that that's the thing for your dog. Does that make sense?
Yeah, I think when you think about the strengthening exercises that we do, because they're reasonably easy. Like, we start easy and we progress. But the reason that they're safe is because, you think about, we've got a new rescue dog and he does a ridiculous amount of zoomies, and he slides. Like, we've got yoga mats everywhere, but he'll slide. And I'm like, oh my gosh, like, you think about what their body goes through when they're just being a
Mm,
dog. And there's
yeah,
no way that my strengthening exercises would ever put them under that type of stress.
yeah,
So, there is a lot of leeway in what a dog can do. But I think, yeah, it's the thing that when you pull all this free information from the internet, it's, are you actually putting it together
mm,
in an effective way? So, that's the most important thing. Because what I'd hate to see is people try all these exercises and then say, oh, exercises don't work. It's like, no,
yeah.
that's not the issue. The issue is that maybe you weren't doing them correctly. Maybe you weren't doing them enough. Maybe you didn't progress them enough. And so it's that ability to talk to someone and problem solve and say, okay, I want to understand more about, you know, why my dog is where they're at with everything that I'm doing.
Yeah, makes perfect sense. So you touched on something really important there about slippy floors
Mm,
and just the general environment that we expect our dogs to live in.
yep,
Here in the UK, there's a lot of laminate, there's a lot of slippy floors.
yep,
Um, And in the winter, a lot of dogs who have the start of osteoarthritis tend to go downhill quite quickly with the damp and the wet. So, what
yep.
would you say about an environment to support a dog, but both to prevent arthritis escalating quickly and also to help a dog where it started to develop?
Yeah, and I think that's really important, because when a dog slips, um, that can cause a flare up. Because if a dog has arthritis and they have a little slip, then they have an injury. And so they have arthritis pain, and then they have this injury on top of that. So they have extra pain, which we call a flare up. And what upsets me most about flare ups is that people will look at a dog that's declined and think, oh my gosh, it's the end.
Mm.
Do I have to put them down? And I know it's very emotional when it's your dog, but being
Yeah.
able to step back for a moment and think, okay, if this is just a flare up, which can occur from injury or overuse, then if we manage it well, we hope that after some time they will revert back to what they were before. It doesn't mean the end. And getting that anxiety away from thinking that, oh my gosh, it's like that. In regards to home, it's getting colder where you are. It's getting hotter where I am. It was so hot today. I had to put on a dress. Um, so yeah, we have floorboards, and I think particularly for senior dogs, it's actually more sanitary to have floorboards,
Mm.
because like we've had so many accidents in the house, and then not because she's incontinent, thankfully, but for dogs that are incontinent, you don't want that always on carpet.
No,
Um,
no.
so laminate is great, but yeah, so we put a lot of most of our floor is covered with yoga mats, and so that's one way to help decrease the slipping. The other thing is like paw care. So nails trimmed, because that changes, their grip and
Mm.
their, the angle that they can walk at. And so yeah, nail length is really, really crucial. The fur in the paw pads, like make sure that they're nice and short. Like I know Frey's fur paw pads like grow in a couple of weeks. Like I have to keep snipping them. So yeah, it's because that makes it really slippery. It's kind of like you're wearing slippery socks. And things for you, like, depending, obviously not with my dog who's an Arctic breed, because she doesn't need warming. But, definitely wearing jumpers for dogs, making sure that they're warm if you can, leaving on the air conditioning at a nice room temperature so that they're not cold. Um, stopping drafts with like one of those draft snakes or elevated beds, like those types of things, just to keep them as warm, because the colder they are, it makes the stiffness worse.
Okay, yeah.
So that's really important. And don't forget, you can also use a heat pack. Heat packs are, most of us have heat packs at home. Make sure that it's a microwavable one. Make sure that it's obviously not going to burn them. But that can be a real soothing element, as
Mm.
part of your treatment as well.
Would it be because if they get stiffer, if they get cold, would it be because the muscles tense against cold, or so
Um,
like
so well,
so
yeah,
like it, yeah.
interestingly,
Sorry, go
no,
on.
no, no, go.
No, I'm waiting for, this is a
So
blooper bit.
interestingly, I know, I know. So it's really fascinating how we always think that, like my human patients will say, "Oh, I know the rain's coming. I can feel it in my joints," and it's not actually the weather. It's not if it's cold or hot. It's actually the pressure. So it's the barometric pressure. Yeah, it's really interesting. I'll geek out for a second. So theoretically, what they say is that the increased barometric pressure actually pushes on those inflamed joints, and that's what makes it more sore. But then also, there are, the cold does, can tense your muscles up as well. So there's a few little, other reasons, but yeah, mostly it's the barometric pressure and not the temperature. Yeah.
That is so fascinating. And
Thanks for letting me be a geek.
I love that. So would the dog, if a dog does have arthritis, an older dog or dog, and then you're taking them out in the cold, is it better to have an all-in-one bodysuit like the Equifleece bodysuit so that you're covering everything but the feet and the face than to have just a jumper that leaves the joints out in the air? Or does it make a difference?
Well, it depends on the temperature. Like well, the pressure. I think particularly, I think also like when we exercise, we feel cold, but then we get hot because our metabolic rate increases as we're exercising. So, I it's tough, isn't it? Because you don't want to overheat them by not letting their well, I mean, they sweat mainly through, they regulate their temperature through their mouth and their pores. I mean, like if it was freezing ice temperature, then I would say put booties on so they don't get freezer burn on their pores.
Yeah.
Yeah, I think just like a normal, yeah, I wouldn't go to overheating. So like putting too much, clothes on them. But again, it's kind of trial and error, isn't it? Like I think you need
Yeah.
to just do it. And you kind of know what temperature it is, and then put their clothes on, and then just see how they tolerate. Like, are they panting more? Are they restless? Like, are they uncomfortable? And then you're like, oh, okay, maybe it's because they're hot, and then see how they go when you strip back a little bit. It's a lot of trial and error to really understand because they can't tell us. We're trying to figure out, what is the best for them. And sometimes, yeah, it's just we've got to just try and see.
Yeah. So nice though that you say it's a lot of trying. A lot of the time we push what we think on way. But what you're saying there, and what I say with kind of behaviour and things, get the information from the dog
Yeah,
constantly.
yeah,
So,
definitely.
with arthritis, what kind of thing would you be looking for? If you look into the dog for information about how they feel and what changes how they feel, what kind of things are you looking for there?
Well, I actually have a pain guide, and I'd love to send it to you if you'd like to put it in your school group. Because there are a lot of, we're looking out for those really subtle signs of, behavioral signs of pain, and so that's what we're looking out for. And um, but in regards to like, if you're stretching your dog, like we were saying before, and um, they if they're uncomfortable, sometimes what they'll do is they might kind of give you a little nip, or like, hey, what are you doing?
Yeah,
Or
yeah.
their eyes are open and their ears are pinned back, and they're kind of on guard because they're like, what are you doing? I'm scared you're going to
Mm,
hurt me. I'm already in pain. So it's really knowing and being familiar with your dog's normal,
mm.
and relating that to what we expect pain behavior to look like.
Yeah, yeah. And coat changes, do you look for coat changes with because at the moment my little when she came and then she'd been here a few months and I don't know why it happens, but every time a dog moves in with me, their hair grows.
Yeah.
And she's now got little flicks on her shoulders, little hair flicks, and that makes me wonder, is she actually carrying tension in those areas because the hair's flicked up now? She only young.
Yeah, no, that definitely is a really important sign. Like I know Freya's hair in her shoulders and her hips started kind of going out.
Yeah,
Yeah, so when the hair isn't kind of in the same position as the others, or you're like, oh, this
yeah,
is a little bit odd, then yeah, that is a response to pain. So yeah, watching those signs, but also yeah, feeling your dog, and do they tense up when you press somewhere? It's like, okay, is that tender? Or like I met a dog a week ago, and for one problem, and yet I found that I'm like, I think this dog has arthritis everywhere, like not only in her hips, because her wrists are swollen, so it's that deformity that you're like, that can happen with arthritis. So, you've got things like deformities. What position are you, posture posturally, how the paws held. And so you're looking at the behavioral side, but the physical side is, yeah,
Mm.
you've got the fur changes, you've got your stance, like how are they actually, like head down, is their back arched? That tends to indicate pain and weakness. And yeah, those deformities, like are they swollen or are their wrists collapsed, or yeah, so just looking at them as just an anatomical position and just trying to see, okay, how does that compare um, to normal.
You've blown me away with your knowledge. Um, it's beautiful, and your passion is so beautiful. There's something else I was going to ask. Little dogs. Do you see a lot of little dogs with tense necks and things for looking up all the time?
Yeah, that's interesting, isn't it? I like, definitely that's a textbook thing. But I haven't seen a lot of dogs like that. Like I haven't, like, because all my patients are big dogs because they're the ones that tend to,
Yeah.
you can notice um, their issues a little bit easier than a little dog because the weight, and also it's, the bigger dog, if they're overweight as well, it predisposes them to arthritis. So I tend to see a lot in bigger dogs, and I feel like people think that it's like, oh, they're just little, they're okay. So again, it's like, well, their joints are still the same
Mm.
as a big one, but I just think that they can carry themselves a little bit easier than a bigger dog with arthritis, and that's why I think they might get overlooked a little.
Yeah. Let's talk about weight. That's really important, isn't it?
Can I geek out again?
Yeah, please.
So there is so tell me, Sally, like, why is weight a bad problem? Like, what's the first thing that comes to your mind?
Pressure on the joint.
Exactly. And it's true, absolutely. Like, I was doing a course once and they said something like, for every pound of additional weight, the hips carry 6 pounds of pressure through the joint. So it's 6 times is quite significant. So you've got that, the actual mechanical pressure that's
Mm.
occurring. But I'm going to geek out. Um, did you know, and you may not know this, did you know that, or you may know it, but didn't correlate it to a dog, but did you know that fat cells are inflammatory? So that's
I
why, yeah.
didn't. I didn't.
So that's why people that are overweight have more health problems. One of the reasons is because their body is just a powerhouse of inflammation. So every little fat cell causes inflammation. And so when you're overweight, you're making like arthritis is inflammation of the joint, and so you're making that inflammation worse. And so that's why weight is kind of a double-edged sword, because it's not only the mechanical pressure, but it's actually like, the physiological inflammation that it occurs. And I want to add this, if it is that dogs that are overweight on average live 2 years less than those of a healthy weight. And I think that it's really something that really encourages me to watch Freya's weight is because
Mm.
I don't want to steal any time from her. And obviously we want all the minutes we can with them. But to really understand that, and I know, like, there's lots of reasons dogs are overweight, and obviously it's not as simple as just food and exercise, but at the same time, I don't shame parents if their dogs are overweight. Freya's weight has gone up and down over the years. Like, if we had another husky before, and so he wasn't eating, so she would steal his food, and so she was getting 2 dinners, and that's why she put on weight. And so I know what it's like. I'm like, and every time I go to the vet, I'm like, what's her weight? What was it last time? Are you okay with this? Okay. And I think it's being able to be courageous and
Mm.
ask your vet, are you happy with their weight? Because sometimes it is, a touchy subject. Like, it's
Mm.
like if anyone talks about my weight, you kind of like, oh, you don't like people discussing,
No.
either you or a reflection of you, which is your dog. We don't want to
Yeah.
hear that kind of negative thing about, weight. And so I think be brave. Ask your vet, say, oh, okay, what was it last time? Are we tracking okay? And yeah, because it's easy to lose, half a kilo than when, they're 5 kilos overweight, and
Yeah.
you're pretty much starving them, and you've got to deal with those eyes begging you for food, and you're like, they don't understand that they can't have more. So
Yeah.
like, keep an eye on it. Um, before it gets into a bigger problem, which not only causes other problems, but the fact that it's so much harder to lose the weight when there's
Oh,
more of
yeah.
it. And I think, is it the same in the UK? Like in Australia, like, we can go into our vet and get our dogs weighed at any time.
Yeah.
It's not something that needs to be charged. So it's like, if you're lucky enough to live near your vet, and obviously, if your dog only needs once a year, my dog's there every few months. So it's obviously she's getting her weight checked quite regularly. But,
Mm.
to not check your weight in a year is quite a long time. So, if possible, if you think that they're kind of, oh, I think they're getting a little bit, I can feel a little bit less bone there, or more, more fluffy, smudgy stuff, then, go to your vet and ask them to, say, hey, can I just put them on a scale, and can you tell me what they were like? So I think it's also encouraging other pet parents, that we're all just trying to do the best we can. We're not here to shame anyone in
Mm.
your choices or, what you've done in the past, but let's work together, be brave, ask questions so that,
Mm.
our dogs can benefit and live longer and happier.
Yeah. I'll be perfectly honest with my dog's weight and my own weight, but I have um, food makes everything okay.
Yeah.
And my dogs aren't fat. They're not fat, but I'd say they could do with losing a little bit. I always say to everyone, they look a bit big, and people are like, no, they look fine, but they are on the heavier side. So I
I,
get that.
Oh, that's so tough. It's nice that you're brave and you're asking people, but I think, are we asking the wrong people? Like, are they just
Mm,
trying, you know, is there truth in what they're saying? Are they just trying to be polite? Like, that's why you
yeah,
can kind of get that objective feedback from your vet, and they can just tell it to you straight and say, look, your
yeah,
dog's 25 kilos. We'd really prefer it to be closer to 23 or 24. You give the objective information rather than saying, oh, yeah, your dog's fat. It's like, no, no, no. Tell me how much they weigh, and tell me breed wise how much they should weigh. And, or
yeah,
not breed wise necessarily, because it's size as well. Like I
yeah,
had two huskies, and yet they would weigh completely different because they were different, shapes.
yeah,
So yeah, it's yeah, and I guess it's hard as well during winter. Like it's cold, you might not go out as much. And yeah, like you do eat comfort food, when it is colder. But again, I think it's like everything, our years, are filled with seasons. Things go up and down, up and down. But overall, if we can kind of keep a bit of a plateau, that's kind of what
yeah,
we're aiming for.
yeah. What about supplements? Because I know that you do a lot of talking about supplements. I'm really interested in what you think about them.
Yes. So, tough one actually, because I what I try and say is that people don't put your hope in them. I think
Mm,
that's kind of what I really want to let people know about, because um yeah, I've just, I led a group that had like 16,000 people in it, in a Facebook group, which is why I changed to school, because I needed something smaller and
yeah,
away from, the noise. And people would just say, I'm doing this, I'm adding this supplement and this supplement and this supplement and this supplement. What else can I give him? And I'm like, have you tried strengthening? Like, it's
yeah,
really, I think supplements are um, people try and use them as pain relief, which I don't agree with.
Mm,
because I think at like an earlier onset arthritis, like the damage may not be significant enough, and that supplement may help with that inflammation enough and the pain. But as the disease progresses, there is a point when you have to go to medication,
mm,
because if you're not dealing with your dog's pain, like I say, I know Cam will say that it's a welfare issue. In she's saying it nicely, I'll say it's cruelty. At the end of the day, if you let your dog suffer, so like of course we all want to do things naturally, but I think we also need to be realistic that when you're like, Freya is equivalent to 90 years old. I'm like, and I look at my 90-year-old patients and they're taking medications, and I'm like, you know
mm.
what, that's just life. We do need more
Yeah.
medications as we get older, as long as we're comfortable. And so I think, so don't use supplements as pain relief.
Mm,
Um, don't solely rely as the only form of therapy, because I think it's wasting your money.
mm,
And particularly don't use like more than one at a time until you know its effects, because not only can they not do anything, but if you're adding all of them, you don't actually know,
which
like
one's
if you do,
working?
yeah, like which one's
Yeah.
working, which one's worth buying, and like I can reinvest that money into something else like exercise therapy or a handheld
Mm,
laser, or there's other things you can do. And so it's trying to, yeah, encourage people to spend their money wisely. I only use one supplement. So at the moment, I use the MavLab joint. It has 600 grams per kilogram of powder of green lip mussel, and that's one of the highest percentages that I've seen. It's got some other like shark cartilage and stuff in there. So really high omega-3s. They are scientifically proven to help decrease pain and inflammation. So I like that. But having said that, since Freya's gut issues, we stopped giving her her supplement, and I haven't noticed a difference.
yeah.
So like, and because we are doing a lot of other things as well, so sometimes you don't know the effects of the supplement until you turn it off. And so I don't put a lot of emphasis on supplements, but it still makes me feel better for using it. Like I do it more for
Oh,
me because I know that
yeah.
it's not actually helping her. Um, like I think that, when you think about, a house, supplements is kind of like what color tiles you choose on your roof. It's kind of like a
Yeah.
fancy finish. Doesn't really matter, like, as long as it's a roof, but, like the foundational therapies of arthritis is, like the foundations of a house is it has to be medication, pain management. It has to be exercise therapy. It has to be a home modifications, and yeah, things like that, rather than kind of the flourishes that may or may not make a difference.
Yeah. Yeah. It's I think one thing that people struggle with, and I certainly struggled with because I had four dogs, four old dogs together until relatively recently, was um the decision of giving pain relief and how that might affect the rest of the dog's body. So the kidneys, the liver, the brain, that
Yeah.
I find that it's you can't, can you? You can't say, would you rather have pain relief and risk um some kind of liver or kidney or organ pressure, and you can't, so you have to make that decision for them.
Yeah, yeah. I guess that's yeah, that's one of the hard things about being a carer for something that, can't speak for itself.
Yeah.
I know for me, like I think it really depends, like case by case. So I think if the dog is in pain, um, obviously, like I think that that's a cruelty issue, because if you've had a pain and if you refuse to take Panadol, or that's your choice. But if your dog could talk, maybe they would like something to take the edge off. So I do think it's a cruelty issue. Um, I In regards to the other effects of the body, I it really depends on the dog. Like, so with Freya, like she's 13 and a half, equivalent to a 90-year-old. I don't know. She's at the end of her life. So I'm like, if I give her, for example, pain relief and it causes her liver enzymes to go up, I'm like, it's like, well, to what end? Like, what is the effect of that? Like, is
Yeah,
it going to go to kidney failure? Is it, but at the same time, we should be exhausting our options for pain relief.
yeah.
Because for me, it's like, well, chances are she could have got liver failure anyway, because she's had liver issues for years. So it's really hard. It is, sometimes I feel that being a senior dog parent is really tough. Like, you have these really tough decisions. And the thing that I always remember, is I try and make my decisions. I think about, can I live with myself? Like when my other dog had cancer and we weren't going to do an MRI. And I thought, if it was operable, could I live with myself? Could I live with the what if?
Mm,
And I decided no, I couldn't. And so I paid the $5,000 to get a scan, because you need to. I think whatever decisions we make, we need to live with them. So I think
mm,
it's more about obviously having those conversations with your vet, because obviously we want to do everything in a safe way. But when
mm,
you have to decide between those things, I think ultimately it's what can you live with, like knowing that
mm,
once they're gone, I don't want to play the what if game. What if I'd done
mm.
that instead? What if I did that? Could she have been, live longer? Or I think she suffered and I didn't want her to suffer. You know what I'm saying? Like it's just yeah, there's no right or wrong. I think everyone's very different in that, but that's how I approach things. I think about, I just never want to be haunted by regret of what
Yeah.
I did or didn't do for my dogs.
And we can be haunted by regret even when we've done our very best anyway, can't we? So it's important that we are also kind to ourselves because we
Exactly.
are
Yeah.
doing the best we can.
Yeah, and I think,
Mm.
we need to encourage ourselves, each other in that, as well as
Yeah. Oh
ourselves.
yeah.
We need to remind ourselves that, what, you're pretty awesome. You're doing an awesome job. It's
Yeah.
hard. We're limited in time and money and energy, and life's hard. But you know what? Like at the end of the day, it's like, I'm a pretty good dog mom. I can live with myself. And I think we all
Yeah.
need to feel that way and encourage others and say, don't be hard on yourself. You're doing great. But also trying to potentially offer suggestions in, trying to help their dog and also help themselves feel better too. But
Yeah.
yeah, it's tough, isn't it? Because we're treating two people, two things. We're treating the dog
Yeah.
and the pet
Yeah.
parent. Yeah, yeah,
Yeah. And we it's normally the people that are the most worried that are doing the most.
yeah.
Yeah.
That's very true. Yeah, yeah. It's a
So
sign, isn't it? When you worry more, it's probably the ones that are, yeah, doing the most. So,
yeah, yeah.
yeah.
We've been talking about
Oh my
leaving.
goodness, time flies when you're having fun.
It does, doesn't it? I wanted to ask you, if someone has a dog that is kind of middle-aged to getting older and they've not had a senior dog before, they don't really understand what to look for. What kind of advice would you give them?
Um, I think it goes back to really knowing those subtle signs of pain. I think if you know
Yeah.
what to look out for to say that, okay, maybe my dog is getting uncomfortable, then I think that's really important, because then you can go to your vet and say, I noticed this. Could you just check it out for me and make sure that they're okay? Is there a problem? Oftentimes, like, I know I'm helicopter dog mom. I ask the vets all these questions. They're like, Kylie, just stop stressing. You're fine. They're fine. It's, but I'd rather do that, and be a bit of a warrior and make a bit of a nuisance of myself than internalize that anxiety and say, but what if and what if? And
Yeah.
so, yeah, so definitely, it's education, get to know the really subtle signs of pain, because they hide it well,
Mm.
and they fool all of us, but we still need to the more we know, the more chance we have at recognizing if there's a problem and then getting our vets to look at it.
Amazing. You are amazing, Kylie.
Oh, you're
Thank
too
you
kind, Sally.
so
You're
much.
amazing too. I love your school group. I love being in your school group. Thank you for having me here and
Oh,
in your school group.
yeah, it's been wonderful talking to you, and I'd really like to see more people join yours because it's a very, very, very important subject. It
Thank
is.
you. Thank you. Yeah, and we need, like in my recent project of the Canine Arthritis Australia, like I think once we get dog professionals like you that are ambassadors who can really, keep flowing that information over to say that it is so overlooked and underestimated, and but at the same time, so easy to make big changes if you know what those things are. So there's always hope. And yeah, I just thank you for having me to hopefully share a bit of that hope.
And yeah, thank you. And I'm so pleased that we met through school. Yeah, thank you.
Thank you.
Okay, so what I'm going to do is I'll pop all the links to your group. Um, when I put this podcast into my group, I'll pop all of the links to your group. So hopefully people who need you will
Thanks.
follow. We do have a few senior dogs in the community. And I'll also pop the links on YouTube and I'll pop the links to your YouTube.
Thank you.
And as you're in the group, when you do get going with your project, you're going to create something amazing that's really needed in the world, please share that as well. Because we have to collaborate. We have to work together.
Thank you.
It is all about helping dogs and their people. So I really appreciate you. Thank
Oh, you're
you.
awesome. Thank you.
Um,
So can I send you that link to my pain guide? Can I just
oh,
send you
please.
my pain guide? Like I feel that if like I'm trying to get it, I'm trying to give it away to vets because I'm really hoping that they'll print it out and just leave it in the waiting room and people will read. Because like I love and respect vets and understand that they're under time constraints and sometimes they can't explain all the pain behaviors that dogs can exhibit, and yet like I've got all of it in a few pages of an A4 sheet. So
Yeah.
just trying to, yeah, make it easy for people to have a quick read and say, oh, okay, yep, I'll keep an eye out for that. That's my dream and my goal. So I'd love to share that, and hopefully it can help, someone in your community maybe detect pain that they didn't know was there, and get so the dog can get the treatment that they needed.
Yeah, I'll pop it with the podcast so people
Thank
can
you.
watch and then read and keep the pain guide to kind of assess their own dogs, and hopefully also if they feel like they need the support, come along to you.
Yep, amazing. Thank you,
Lovely.
Sally.
Um, it's night there, isn't it? So
It
thank you
is.
for
It's
spending your time with
9 p.m. and almost past my bedtime.
I know I'm normally in bed way before that.
Yeah, yeah, no, I like to rise early and go to bed early. So
I love
yeah.
it.
But it's been an absolute honor. I am just blown away by your kindness and generosity in school. I'd really love to just chat to you again, just as a fellow human being,
Oh
and dog
yeah.
parent, and just yeah, like yeah, I'm so thankful. Thank you.
Yeah. Yeah, I mean, if you need any, I don't know if I've said that me and my husband set up a few big dog businesses before this part of my life. And so we set up online courses and all sorts of things like that. So if you need any help with your project in any way, just give me send me a message and we'll get together. And even if you just want to, bounce ideas off, I'm up for that.
Oh, you're so sweet. You're so
Yeah.
sweet. Thank
I
you.
can't
Appreciate
bear
it.
to
And
see dogs struggling. The
yeah,
more
I know.
people we
It
can
just
reach, the
makes you sick,
better.
doesn't it? Makes me want to cry. It makes me want to vomit. Like it's
Yeah, it's
it's
horrible.
just awful.
Yeah.
But yeah, I'm just so encouraged by you. And yeah, I'm so glad that we met. So thank you
Yeah,
again.
and me. And I'll see you again soon. I'm sure I will. Thank you.
Bye.
Bye.